Welcome to the office.
Thank you so much.
What brings you here?
Pain brings me here.
What's going on?
Actually. It started 1 year ago. We were at the church conference, and I'm a very sportive person. I do a lot of jogging. I did all kinds of sports, athletics, horse riding for 18 years. So I did a lot of stuff. And then on the 14th of April, I went jogging with my future husband.
Okay. So after you stopped jogging, you couldn't sit?
I couldn't do. I started because we had a meeting, right? So I was sitting in there, and then it started to hurt and hurt and hurt, and the only thing I could do is lay, and it hurt so much even to lay.
All in your low back?
All my back hurt. Just my back, especially left side, hurt so much, and I didn't know what's going on. So I went to the emergency, and they took an X-ray, said everything is fine. You just have some pain. Gave me a painkiller. But
how was that?
I was crying a lot because I was like, please, I'm not fine. I feel it. Something is wrong. I said, no, it's good. I see all your bones are not broke. It's fine. And then it got worse and worse, and I was 3 months laying, not moving at all.
This is in Germany still?
No, in Switzerland.
You went back home?
Yes.
Okay.
So I couldn't move at all. I didn't move. I was just laying the whole day with my feet up. I could just lay in one position.
Okay.
And not out of position, and I could stand up for half an hour before it started to hurt a lot.
And all you were doing at that point was painkillers?
Yes, a lot of painkillers, and they gave me
anti-inflammatories?
Yes, and they gave me 30 injections into my back.
How many injections?
30.
30? Cortisone shots?
Yes.
Over how long a period of time?
Half a year.
Excuse me?
Yeah. They just didn't know what to do because it was so...
Well, what we were taught is after 3 cortisone shots, it starts to demineralize bone.
Yeah.
So they told you the side effects?
They told me that it could happen, but they said...
there's nothing else you can do.
And then I saw a very good sports doctor, and he said, you have this and that. And I was like, okay. And
what is this and that?
He said, I have not a same leveled hip. Because of that, my spine curves a little different than it should. And he said I have my muscles are just tight, but it will loosen up with time again. It's just like a tight muscle because it tried to balance.
On your left side?
Yes, because it tried to balance something out. I was like, okay, and he's like, it's just that, nothing else. Like, okay.
And this is how many months after the initial injury?
Maybe 5 or 6.
So 5 months into it, nothing's releasing. 30 cortisone shots.
Yes.
And okay, the sports guy said it's a tight muscle.
Yes.
What was the treatment, or what was the
he
fix?
gave me these shots and
more shots.
Yes, and he released my hip. He did the movement to release it a little bit.
Okay. Did that help?
Yes, but like the next day it was the same again.
Okay.
So this was always what I said. You know, it feels good when you correct me, but then it's just the same again the next day. And I was very hopeless because I felt that he didn't understand me, and I was just like this patient who is just making it up and like simulating, but I really wasn't. And he said it's connected with my brain because I have so much pain, and now it's chronical. It's not really there, and it's not sure I really have it.
Okay.
And then I went on with physical therapy. It helped me a little bit, but it started to just stay at a certain level and just stop.
So what's your pain level right now?
Right now, since sitting so long, I'd say a 7 or 8. Now I'm at the left side. Is my entire left muscle here is stiff, like really hard.
It's not releasing.
It's not releasing.
You said you saw a chiropractor here in California.
Yes, two times a week.
And did they tell you what was the problem? What was causing it?
He doesn't know. He told me that.
So what were you getting adjusted then?
Just normal chesting, hips, back,
There's no such
neck.
thing as a normal adjustment.
Okay.
So you were getting what's called a flying 7. So you had that done. It was helping you maintain. It lasted a couple of days, a week, 2 weeks?
No, it can last maybe some hours.
Some hours.
Yes.
You were getting a flying 7 twice a week.
Mm-hmm.
You still didn't know what the cause was, so that's what we need to figure out. What is causing all this? That's what we need to figure out.
Yes.
Okay? As you're walking, I'm just kind of seeing what's going on. Your pelvis should move like this.
Oh.
Your pelvis moves like this.
Oh, got it.
We call it the waddle.
Got it.
We don't want a waddle, lady, okay? So I'm going to exaggerate. This is how you walk.
Really?
Okay? You're walking like this.
Oh yeah, like a penguin.
You don't want that. So the first thing I'm doing, I'm running a meter on your spine.
Good.
And this is going to help us kind of determine where the inflammation is to focus the exam.
Gotcha.
So I got a little bit going on the top left atlas. We went through your x-rays. And we talked about this left pelvis is what started everything. And it is possible that this, whatever happened when you were in Germany, that wasn't the cause, by the way. That was a trigger.
Oh yeah. Oh.
That was just a trigger. You've had these issues for a while.
Yes.
And it could be from horseback riding. It could have been from any of the sports you were doing. Okay? Regardless of what it was, we gotta figure out what it is.
Nice.
Okay?
Good.
Cool. We got L5, we got around L5S1, we got around T6, T7, and we got at the base of the neck at C7, T1. So I got 1, 2, 3, 4 areas of potential, okay?
Okay.
We're going to statically palpate head down, and let's see what's going on this way. So as I'm running it, you can see the tissue changes right there. And if it orange peels there, if I push in there, is that tender at all when I push in there? Or is it just pressure from my finger?
That one feels just like pressure.
Okay, so this lady, you have a high pain threshold. You've been dealing with this enough, haven't you? Okay. Right moves well, left doesn't move as well. That's the upper cervical, okay? When we go into extension, we're going to isolate the lower cervical. Look up, turn left. It moves a little bit better that way, yes? And it moves okay that way as well. So if I have to decide between the two, because we have a reading here and here, we're going to go with the upper one. Next, let's check the pelvis. Scoot forward, please. Open and close. Good. Right side only. You can see clearly when she does the right side, the whole thing shifts. Left side only. When she does the left side, the right doesn't move as much. They should be independent. This is a left pelvis issue. That's sacrum. Sacrum is moving though. 5 is not moving as well, right? There. You feel that? Okay. L5, left pelvis. So this is actually starting there. Do you feel that?
Yes.
C2. We know this is starting at your left pelvis.
Yes.
We know there's something going on in the upper cervical, even though it's not the cause, because you've had layers of stuff over the years, right?
Yeah.
And you were asking a question.
Yeah, so doctors told me that it's just muscular. It's nothing with the bones, nothing with the nerves or anything like that. But it feels sometimes like a nerve because it feels like tangling or like ants all over my back. And usually I know that feeling from a nerve. And I just wanted to ask.
Okay, so here's the thing. Muscles receive instruction, they don't give.
Okay.
And a good friend of mine who's a physical therapist taught me that. I said, I'm using that line because it explains it well.
It's very clear.
The muscle is responding to something else.
Yes.
We went over defense mechanisms, and the muscle will spasm and guard where there's instability.
Exactly.
So if you're dealing with muscles, yes, the muscle is related. Is it the cause? No.
Yeah, no.
In your issue, no. You have a pelvic imbalance. There's 12 millimeters of rotation in the pelvis. If that's rotated, think of it like a pulley system at the gym, right? You have the cables and the pulleys. These are the joints are the pulleys. These are the cables. When the pulley's off, the cable can either get tight or loose.
Oh, okay.
It's not going to be smooth.
Okay.
Okay?
Okay.
Your pulleys are off. So the cables, which represent the muscles, are tight.
Okay.
Okay? C2. Breathe for me, please. Breathe. Breathe out. Good. Breathe in. There you go. Gotcha. Okay. Let's walk that off once, please.
I feel that already. Feels good.
That should already have loosened up a little bit.
Yes, it feels really nice.
Yeah. On the eye and ilium. Maybe I just move that. I gotta stretch that shoulder up, okay? You okay with that?
Yeah.
Is that okay on your shoulder?
Yes.
Home run. Give it a second, okay? Push yourself up, swing your legs down. Breathe. Breathe. So, by the way, that cleared your mid-back.
Oh.
There's no there's 2 points now. That did it. Right side only. Now you see the left side doesn't go with it. Left side only. They're moving more independent now. Watch her dimples here now, please, and watch how she walks. Yeah!
Really?
She's doing this now.
Oh my god!
You'll see it.
Nice.
Still a little bit there, and I'm not saying we're fixing it in one adjustment.
Yes.
Your homework is going to be lots of walking now. You're going to be able to. Now, I'm just going to get these started. I don't want to start yanking and pulling on the legs or doing that. I just want to get them going so that it's going to help with your walking, okay? Yes. AS talus, I'm assuming it's tender there. I'm assuming it's tender there as well. Yes. Okay? That's it. Walk it off. Squeeze my hand. Squeeze hard. Good. Relax there.
Oh yeah.
Squeeze. Good. Squeeze. A little bit going on your wrist.
Yeah.
Distal radius, lunate scaphoid. Squeeze now.
The left side is always a little numb. Still, I could feel the numbness. Where is this coming from?
If it's a tingly or a buzz, that's not numbness.
No, it feels really.
So you don't feel it.
Yeah,
so if
I feel some of it, but it feels.
So when I go here versus relax your hands.
Yeah.
Here versus here.
Yes, left side is a lot more.
Okay, so then here's what's going to happen. It's going to hurt a little bit before it gets better.
Okay.
Okay, you're going to tell me the day it does.
Thank you.
You're welcome.